Good morning, everyone. Good morning. We're going to get started. It's good to see all of you guys. And good morning to our Zoom attendees hanging out with us as well. Jesse has our live stream going, but it's wonderful to see folks here in the room with us. I hope that everyone here in the room was able to grab some breakfast, grab some coffee, something. And part of that role is that I have the pleasure of being the staff liaison to the Chamber's Healthcare Association. And so grateful to all of you guys to joining us for our quarterly roundtable discussion. Hope that it will be super helpful to you guys. Just a couple of housekeeping items. I did mention our Zoom audience. So we want to be conscientious of our audio. So as our facilitator engages us in discussion, if you have a question or some feedback for him, we do have a mic that we can get out into the crowd. So please be cognizant of using that so that our virtual audience can hear. And then to my virtual attendees, wherever you may be this morning, please feel free to put your questions and feedback in the chat feature. Jesse Martin on the Chamber team is monitoring that for us and can get that to our facilitator today. I certainly want to thank the Healthcare Association title sponsor, Northside Hospital, and thank them for letting us continue to use their space. With that, wanted to introduce my good friend from Northside, Kathy Galbraith, just to say a few words of welcome to us, Kathy. Yes, you definitely need the mic. You don't have to.
No. Good morning, everybody. Thank you for being here with us today. Honestly, I just want to talk about a couple, 3 things that are coming up, chamber related. We do have another H-Day breakfast in November. The chamber has Mingle Jingle in December. And then of course, you guys remember the kickoff event with me, that's January 22nd. So mark your calendars, or if you see emails from myself or from the chamber, definitely tune into those, because those are probably the most exciting things that are coming up. That gives you the opportunity to get out, face to face, mingle, network, and also grow yourselves. So much.
Thanks, Kathy. Will you help me thank Northside and Kathy for hosting us this morning? However, our roundtable series would not be possible if it were not for the support of other businesses who are investing, particularly in the healthcare industry. One of those is our title sponsor of the roundtable series, Brandywine Printing. So I want to introduce Derek Brooks with Brandywine Printing. Welcome you guys as well.
Thank you, Laura. Thank you, Kathy, for giving us this room to be in. So if y'all haven't seen me here before, because you're new, I learned that the way to get to y'all, this particular group, is with a joke. So I know that you come, those of you who are coming back, only come for my joke, regardless of who the speaker is, right? So today the joke is, why do doctors carry a red pen? Because it's the only way they know to draw blood. I said it, you didn't say it. All right, so I want to let you know Brady White Printing exists to help other organizations like yours succeed. And we do it by improving their image with printed materials or making them more efficient with printed materials. So if you need to look better or get more done, think about us, give us a call, we can help. I was talking to Laura about this the other day, and the subject of AI that we're going to talk about today, I'm actually putting my entire staff through an AI training course because I believe it's very important. It's as bad as it's ever going to be right now. It's only going to get better, and it's important for us, especially as we face workforce issues. And I don't know, just give me, if you face workforce issues, let me know, because if you're not, I'm not going to say anything else about it. Oh, y'all are all fully staffed. Okay. Everybody else is not. So I'm really excited what AI can do for us. I'm excited what we do at the Chamber with the workforce. We've got a whole organization in there called FOCO Works, and it's all focused on developing the workforce in Forsyth County, being sure that our schools are teaching what our employers need. So be sure, if you're not involved with the internship program with Forsyth County Schools, ask more about it, because we've got some great students who can work in all of your practices as interns, and you will be happy with it, I promise. So thank you, Laura. Y'all, I'm excited to hear the message today.
Thanks, Eric. In addition to Brandywine Wine Printing, this series would not be possible without our Healthcare Hero sponsors, Apple Spice Catering and Central EMS. And then our care sponsors, Dental Partners of North Georgia. We have Dr. Ben Miller here. Thanks, Dr. Ben. Hallmark Home Care, Jean Roberts and Kate are here with us. And Assisted Living Locators, Greg Santini. Thanks, Greg. And there is, please take note, to continue education beyond today. Assisted Living Locators has some information on your table for you to be able to do that. And then our breakfast today, which was provided by Eggs Up Grill. So y'all help me thank these sponsors for making today possible. And now I am excited for us to get to our discussion. Today's discussion is going to be facilitated by Hussein El-Haj. Hussein serves as the Director of Business Development and Enterprise Strategy at eClinicalWorks. We connected via the Chamber's Tech Execs group, which is another industry-specific group that one of my other colleagues leads, similar to our Healthcare Association. So it was nice to have this resource via another group of the Chambers. But I'm excited for Hussein to join the Healthcare Association today and be part of our industry-specific group. So please help me welcome him to joining us at the Healthcare Association today.
Good morning, everyone. Hopefully you can hear me. Right. It's going to be tough to follow that joke. So I'm going to try to stay away from jokes. But thank you so much, Laura, for the invite. We appreciate it. And thank you to Northside for hosting us today. Topic has the potential to be very dry today, so we'll try to keep it as basic as possible and focus on use cases that really, we think are relevant to the industry. So that's what we're going to try to focus. I'm going to do some double work because we do have a presentation for our virtual audience, so I'll be clicking through here. And I do want to thank Laura for the title of the presentation. I know we have a lot of going back and forth. We're like, what do we call this presentation? So enhancing your practices. I think it's a great deal. Again, I'm the Director of Business Development for eClinicalWorks. Some of you may be using eClinicalWorks. Okay, great. We got some members in the audience. And I think the presentation will be generally enough that even if you're using a different EMR, we can talk about strategies that can benefit you as well from that perspective. But there we go. let's start with a very basic question, right? We'll start basic and we'll try to get a little bit more technical, and once we reach that peak, we'll pull back a little bit. We don't want to get too technical, right? We want to focus on use cases. But what is AI? Right? Hopefully everybody knows what it stands for, artificial intelligence. Right? Good. Okay, we can level set over here. But AI essentially is systems, right? And when we talk about systems, it is systems that are capable of performing tasks that are generally reserved for human intelligence, right? So, quick question. You nodded over here, so you get the first question. Right? Can you answer the question that's on the screen? Yeah. Yeah, perfect, right? So that's human intelligence right there. So, that's great, right? So artificial intelligence really falls into two major buckets, right? You have deterministic AI. You know what the answer is going to be, right? It's a simple formula. You can calculate it on paper. You can build an algorithm. You can have the system, set these parameters, and then just give you an output, right? It's pretty simple, right? And what if I asked you, how do I get to the closest Chick-fil-A?
Then just look up your map.
Okay. Yeah. So that's the artificial component. Right, but that's where patterns come into play, because that answer could vary depending on the time of day. Right, if there's traffic in the morning, I may not want to take this road. I might want to take that bus. So there's a logic component, right? And the data that you feed the AI system that you built will essentially result in whatever that output is going to be, right? So that's where patterns come into play. We also have voice recognition components. So we've seen, and AI has been here for quite a long time, right? Now it's getting to the point where it's going to the next level. So we'll delve into that a little bit. But speech is a component. So we talked about patterns, we talked about speech as a component, but ultimately it's got decision-making and problem-solving capabilities. And these are generally capabilities that simulate human intelligence, right? That's essentially what it's doing. Now, let's talk about navigation. We were talking about navigation a little bit earlier. Everybody use navigation, right? Hopefully. Do you use it? Let's say you have a destination in place and you miss a turn. What does it do on your phone? It corrects, right? So it recalculates. That's the patterns component. Now, does anybody use navigation for when you know where you're going? Right?
Use it all the time.
Yeah.
For traffic.
Why do you use it exactly? For traffic, right?
To know the line of traffic.
Yeah. So there's other variables. I personally like to use it because I love to hear you have a ride. It's good for my self-confidence, right? But navigation has been there for quite some time. Now we are talking about self-driving capabilities and other things. So that's where we're going to that next level, like transformational, right? So let's talk about some of the disciplines of AI. We'll call this the acronyms. You guys are in the healthcare industry. You know acronyms, right? If you deal with CMS and all of that, there's probably a department that just generates acronyms, right? Your MIPS and your MACRA and your HEDIS and all of that stuff. So I think we'll start to see a lot of acronyms in the AI space as well. But there's a lot of disciplines. I'll focus on just a few that are relevant to our industry, right? So under AI, you have machine learning, right? So machine learning at a basic level requires human intervention, right? So you build a script. Right, you have a developer that builds a script, and you feed it data, and you have an output. You have information that comes up, and you take that information and you validate that information, and you determine what the accuracy of that information. If that information is not very accurate, right, based on your sample data, you go back, you tweak, right, the algorithm that you have until you get a favorable outcome, right, until the accuracy is there. So that's machine learning at a basic level, right? Then we get into deep learning. So deep learning is when the system is able to make its own collections, right? So you no longer need that human intervention. You've given it the data, you've fed it a lot of data, and the quality of your output is determined by the quality of data that you feed it. So we're going to talk about, public domain and private domain. All of these things really determine the outcome of your data. So as far as deep learning, you've seen things like computer vision, facial recognition. We talked about that there's some controversy around it, right? Facial recognition and whatnot. And then under deep learning, you have LLM, large language models. And that's what we're seeing in the healthcare space, is the ability to process a tremendous amount of data. Things that could take a human person thousands of years to do, right? Now they're processing data significantly faster. But the big thing about large language models is because the data sets are so large and it's able to self-correct and do all of these things, now it's able to synthesize and generate, right? So generate images, generate videos. I'm sure you've seen videos of politicians saying things that they would never say. It's not them. it's a generated AI video is what it is. So can be pretty dangerous, right? That's why you have to sort of put some parameters and put some borders on it and whatnot. But one of the biggest outcomes of this large language model generative AI is something you guys are all familiar with, which is ChatGPT, right? And my kids use it against me because my son wanted to extend his bedtime. He brought me, a 4-page dissertation on why I should be extending his bedtime, basically. So I just wanted to make sure we're on the same screens. But all you go public domain, and you can request for information, and that data may or may not be good, right? Because God knows not everything is accurate on the internet. I know sometimes we use it as gospel, right? When you just Google it. You get good data, you get bad data. So from a technology perspective, from an organizational perspective, you need to be cognizant of the data sets that you are given that AI. That's going to determine how well you do or what is presented to you. So there are many familiar applications over here. All right. This is a PDF, my apologies. There were supposed to be some pop-ups on the screen, but it's okay, we can talk through it. So from a familiar application perspective, machine learning at a very, very basic level, anybody have a Roomba home? Right? What does it do? Right? Essentially, it scans, the layout of your house. It knows where you have a chair, where you have a couch, where you have a garbage can. It remembers that information and then it self-cleans the house, right? Then you have, sorry about that. You have image AI. Anybody have an iPhone over here? How do you log into your iPhone? Yeah, Face ID, facial recognition. Ambient AI, so this is speech recognition technology, really relevant in the healthcare space right now. But anybody has a device at home, like a home device, Google Nest thing, you ask it to play music or order stuff with you. So that's something that we've seen for a few years, right? And then of course, large language models, we talk about ChatGPT. That's the biggest one. So a lot of stuff that it could do, right? It's very powerful, and with great power comes great responsibility. You got much time. So let's talk about ethics, AI ethics and responsibility. And these are things that are extremely important to consider from a technological perspective, especially for us, a large, healthcare software company. These are things that must be considered. First of all, is it fair? Right? So when we're building AI and we're feeding the data, is the data biased, right? Because your outcomes is determined on the data that you feed. So you have to ensure that there's no bias in any model that you create, or any variable that can introduce a bias, right? Is the data set explainable, right? The methods that you're using, the expertise that you have, are you able to explain the data that you're using? Or are you afraid to share that information? How do we know if it's accurate or if it's not, right? Robust, that's a big one. Can it handle unique scenarios, right? Or is it just basic commands that it's able to handle, right? So it's supposed to think logically, and whatever you throw at it, it's supposed to try to make sense of it. And again, self-correcting. Transparency is a big one. So the output that I have, do I have the ability as an end user to look at the output, determine if this is accurate, or edits need to be made to it. And do I accept it, or do I have the ability not to accept it, right? Do I have the ability to edit it? So that's where transparency comes into play, because it's a developing system. It's going to get, smarter in time. And I think you said a little bit earlier, this is the worst that it is right now. It's only going to get better from here, right? We still have to put technology out there because, perfectionism is the enemy of progress, right? So you have to start with something, get feedback, continue to improve upon it and whatnot. And data privacy, given that we are in the healthcare space, there's nothing more important than data privacy, right? You have servers, the companies that you're using, are they using private servers? Is it private domain? Is it public domain, right? So these are all things that have to be considered, especially if you're using third-party tools, right? You have to be cognizant. Are these tools HIPAA compliant, right? These are things that are important. How well is it embedded into the systems that I use? So, and then, going a little bit further over here, you have people, process, and tools. So, even if you are developing the tools, is there diversity in the people that are developing the tools? Because if there's diversity there, then the data is going to be representative of the population, right? And do you have, strong processes in place, strong governance? Do you have a really strong software development lifecycle? So if you need to make edits, or if you need to make enhancements or corrections, is there a cycle that is uniform that you go through to make sure all the checks and balances are in place? And of course, do you have the tools? You have the knowledge, the engineers, methods, framework, all of that. So that was pretty technical. And this is as technical as we get, I promise you. But from an ECW perspective, this is not a sales pitch by any means, but from an ECW perspective, we developed some of this technology, and there are some pillars that we use as foundation. Just want to make sure we're on the same screen. For any tools that we embed, incorporate, or develop into our system. First of all, AI should be used in a co-pilot capacity, right? It's not there to replace the work that you should be doing, decisions you should be making. Okay, it's supposed to assist you with your decision making. So in a co-pilot capacity, we never want any AI tools to make decisions or documentations or finalize stuff on your behalf, right? Okay, should say this is what we think it is. Do you accept these changes, right? So the user should have full control over the final decisions or the final application. Okay, so that's the first component. Second is private large language model, private LLM. Most companies are leveraging ChatGPT. Right? You guys can go online right now to ChatGPT and type away. Yeah, make whatever request. We don't want to use public domain because then we cannot be sure of the accuracy of the data. So we have to privately license tools like ChatGPT on our own private servers. Why? Because then we control the quality of data that goes into it that is processed, right? And even though we're leveraging tools, so for those of you that don't know, ChatGPT is a product of OpenAI, and Microsoft, I think, has a 51% stake in OpenAI, right? So our company uses Microsoft Azure servers, but we manage those servers, they're private instances as well. So even Microsoft and OpenAI, they don't have access to our patient data. Okay, really, it's much more expensive to license a product than it is to use public domain, right? But you have to, spend it, and over time, maybe the cost will come down, and from an end user perspective, it will come. It's like the first flat screen TV that came out, right? What was it, like $20,000? Now you can buy one for a few $100s. But the private component is something that's very important. No sharing customer data with any third-party vendors that you use. So you're HIPAA compliant. And then the third foundational thing that we're looking at is how do we use AI? And it's really intended for efficiency, right? We want to use it to augment, not replace, because there's always this fear in the industry, oh my God, we're going to lose jobs, right? We're going to get rid of people, computers. No, we don't want that, right? We want it to augment. We know there are, in the healthcare space, there's enough that we have to do. There's enough efficiencies that we have, that if we introduce inefficiencies that we have, that if we introduce efficiencies such as this, then people can focus on patients, right? That's ultimately what we want to do at the end of the day. We're in the healthcare space, but we are in the customer service industry. right? So how can we improve our interactions with our patients? So can we automate things that are just manual, right? That don't really need human intervention? And can these systems just provide insights, right, and suggestions, and then you make the decisions, right? So these are the things that are important. And now, at this point, this is where I want to get into use cases and applicability over here. Now, we'll talk about 4 core areas. I want to talk about the ambient listening component and how that is applicable in that space. And I think we've had some components of it for years. Want to talk about that image AI component and how can that be used for things like fax inboxes and whatnot. Interoperability is another component I want to talk about. So over maybe the past 6 to 8 years, it's become a big thing, the sharing of data between organizations. And sometimes there's a lot of data there, it's overwhelming for physicians. So how can we use AI to help us make sense of that data, right? But we'll talk about other generative AI features, especially from a front office perspective, right? No-shows and things along those lines. But we'll start with physician burnout. You guys believe that it exists, right? It does. I know a lot of physicians are seeing probably on average 25, 30 patients per day, right? If you're seeing that many patients per day, I know some see even more. How much face time can you truly have with that patient, right? If you're seeing that many patients per day. And we did an internal study with about 1,000 providers. And 4 in 10 physicians pretty much told us I spend about 4 hours per day doing documentation, right? Forget the patient component, doing documentation, right? Fulfilling administrative tasks. And a lot of that is done at home after hours, right? You go home, you have dinner, you sit, and you type away. So how can we use these solutions to help minimize all of these efficiencies for providers? So speech recognition technology has been there for quite some time. Anybody familiar with Dragon? Right? All providers that I know use Dragon. Now, Dragon is a speech-to-text technology. And essentially, it's a monologue, right? So the provider goes in there, they saw a patient today, did this, and that, right? So it's a monologue between the provider and the computer. How can we make it a dialogue where the system is just ambiently listening in the background and doing all the work for you afterwards? So that technology currently exists right now, and it's being applied across the board. And our company alone, we have over 40,000 providers that use it, but there's many different technology out there. So what does it do? It does a couple of things, right? All right. Okay. So it sits there in the background and it just listens to the conversation between the provider and the patient. The first big thing here is it's allowing the provider not to focus on the computer, which is what they usually do, right? They're speaking to the patient, but they're trying to complete the note at the same time. So now the provider can sit, have a conversation with the patient, talk about their history of present illness, subjective information, social history, family history, what are some of the contributing factors, to your condition, do a review of system, do an examination, right? And even talk about, this is what I think you have. These are the things I'd like to do. I'd like to order this medication for you, this lab test, this x-ray, and then have the system generate a dialogue flow, right? So providers are completing documentation to some extent after the visit. A lot of times they're also trying to remember what it is that they discussed with the patient. If I'm seeing 40 patients per day or 30 or even 20 patients per day, like, what did I discuss with this patient, right? So when you have a dialogue flow, think about a text between you and another person. You got 2 different bubbles, right? So there's that speech, the text component that's been there in the industry for quite some time, right? Then we get into the second component is, this is where ChatGPT comes into play, and it will take that text and actually create clinical documentation. So the technology can actually start to partition information and say, this is the clinical summary of what was discussed, And this component we're gonna put in the HPI, we're gonna document the patient's social history, family history. We're gonna queue up your orders based on the compendium of labs that you have, the compendium of medications that you have in your system, diagnostic imaging. We're gonna queue up your orders. We're gonna queue up your ICD-10 code as well, right? Your assessment codes. And we're gonna present this summary to the provider, and the provider will have the ability to validate, review, modify, and determine what to import into the final progress. This is technology that currently exists right now. It's saving doctors on average about 2 hours per day in clinical life. So what do I do with an extra 2 hours? Some will say, I'll see some extra patients. And some will say, let me have some quality time with my family afterwards. But it exists because this is essentially what it looks like. So when you pull it up on the right side, you have your actual script, right, between the patient and the provider. And by the way, it's moving to the point where even if a patient speaks a different language or they have a translator, our company currently supports Spanish, Portuguese, and we have 12 other languages that will be coming out soon. But because this technology exists and it's accurate, we talk about natural language processing, you can have a translator in the room, or you can have a patient speak in a different language, and the system will automatically translate it with high levels of accuracy right now. So now we remove barriers to communication with the patient as well, right? But most importantly, and I will continue to reiterate this throughout my presentation, is no decisions are being made on behalf of the physicians. You should never use any technology, whether it's this technology using ECW or third-party technology that is making decisions on behalf of the providers. Okay? We wanted to make suggestions, queue things up, and then as a provider, I can review, I can make edits, and I can determine what to import. Now, if I do this, I no longer have to go search for the appropriate ICD code and then put it in that screen. Then I got to go to my order screen. I got to search for my orders and put that in, right? Then I got to complete this documentation. It's all queued up for me. I just have to accept. But the best part is you take 100 providers, and I guarantee you have 100 different methods of documentation, right? Providers are unique from that perspective. So this is something that's going to learn from the edits that you make. So if as a provider, I look at this and I'm like, you know what? I need to make an edit to the HPI section. I want it to state this. Now it's starting to pick up on your habits. That's where it's learning. And it's saying, okay, these are the things that should be suggested. Or if I change the assessment code that is being used, or if I change the order that it gave me a suggestion for, it's going to learn from that and make alternative recommendations in the future, right? So this technology is there. It's also incorporated with telemedicine. Telemedicine was extremely popular during the pandemic, right? And everybody thought that it was going to go away after things went back to normal, but it hasn't, right? It still happens. There's still some patients that can't physically come to a visit. And with telemedicine technology that's embedded into your system, the AI component that can listen to your conversation in a clinical setting also has the ability to listen to the conversation, create a script, right? Give you total insights of the patient on a television as well, okay? So we will continue to see more and more advancements, more and more accuracy that is happening. But it's here right now. We don't want to talk about AI as if it's something that's going to be there in the future, right? It can be utilized right now. And then if you're using a technology that is not embedded into your EMR, like maybe you still generate the clinical summary, all of that information, but you may have to do some copying and pasting into the system. And that might be the case. There's different companies out there with different price models, but the level of integration is going to determine, what you do with that data at the end of the day. Okay. And we can make this interactive. If you guys have any questions or, where you're welcome to raise your hand and ask about any questions on this component. Sure.
Question, has anyone? Is this technology only compatible with ECW, which is eClinicalWorks?
Yeah.
Or is it compatible with Athena, and others as well.
Yeah, good point. So if you guys haven't heard, the question is, this technology is only compatible with ECW or other EMRs as well. So ECW obviously has a fully embedded solution, right? But it is compatible with any other EHR, depending on the level of integration that you want with your system, right? So with ECW, it's actually accessing your compendiums, as we talked about, of medications and assessments, and queuing up orders and putting data into your system in a structured and non-structured capacity, right? Now, if you use this technology as standalone and it's not integrated with your system, you will have the summary, and you could probably import that as a PDF document of sorts, right? Or maybe you can copy and paste different components. But a lot of this technology, they support also different integration protocols. So there is an integration that can be done. Now, if they're using Athena, I would probably have them reach out to Athena and say, do you guys offer a similar technology that is more embedded and integrated in the system? Because I assure you, we're not the only company that's doing this, right? There's many companies that are doing that as well. So, but from a capability perspective, I know even our technology, it's capable of being integrated with the system. But, you know, large EMRs, they make different business decisions as to what to integrate with their system and what not. Okay? We're good on questions there? Okay. Right, so that's one component from a physician perspective, right? We talked about speech technology going from a monologue to a dialogue, and you don't need any special equipment to do it. As long as you have a computer that has a mic embedded in it, right? Or you can even get an external mic, that is sufficient. Most of these technologies as well are offered on a mobile application on your phone, right? So you can just carry your phone in with you. The biggest thing is that removing of this device between me and the patient, right? And allowing the provider to really engage with the patient. So we think that's going to help. Then we get into some other administrative functionalities. Fax inboxes, right? Fax is still a very common technology, as antiquated as it is. It's still a very common technology. And there's been many different things. I don't know if you guys are familiar with direct messaging, secured messaging between providers. And there's all of these, you know, technology platforms to allow you to communicate electronically with other providers in a secure capacity. However, faxes are still the most commonly used method of data exchange. And I can't make sense of it, right? Our company trying to make sense of it. It is a reality. Okay, working your fax inbox is a pretty manual, time-consuming process. I work with clients that have dedicated staff. All they do all day is go through faxes, right? And they open up a fax, they read it, they're like, what kind of fax is this? Which patient does this belong to? Sorry, I meant to be on that slide for the virtual audience. But there's a lot of manual work that can be done. Now, Image AI is there, right? It's got facial recognition on the iPhone. Why can't I use it to read documents and help me assign information to patients? So this AI is being integrated into your fax inbox. And the goal of this is, rather than you as a patient opening up a document, right, trying to figure out which patient it belongs to, trying to figure out what kind of document it is. Is this a referral document? Is it a lab document? Then I got to search the patient, attach it to the patient, address it. I see you're not in your head there, right? So this is where AI can scan the document and then pop up a screen and say, you know what? This is who we think the patient is for this document. This is the kind of document we think it is. So I'm going to go ahead and pre-fill the patient data for you, pre-fill the folder that it needs to go into. And if it's a special kind of document like a referral, maybe you want to queue up a referral for you, right? And then you could validate this information as an end user, and then either accept or not, basically. Okay? So when we look at the document management process, a lot of steps. Regardless of what system you're using, whether you're using ECW or any other system, going to the fax inbox, selecting document, patient lookup, all of these things. Can we remove a lot of these steps and basically go to the fax inbox, select the document, verifying close, right? Let the system do the other work. If we could save 80% time there, you know, do you really need to have that many dedicated staff members to the fax inbox? Or can they focus their efforts elsewhere that are more beneficial to your organization? And I'll just show you some screenshots here of something, excuse me. But this is a document over here that's handwritten. It's not even a typed document. It's a handwritten document. The AI component is actually able to make sense and identify who the potential patient matches, right? And again, we don't want to make decisions. There might be multiple John Smiths in your office, right? Maybe really similar birthdays. So you can see a list of your potential patient matches. Again, you, the end user, you're making the final decision, right? Or what if it's a document like a referral document over here? Okay. The difference, and I don't know if you can see that screen over here, is it allows you to queue up a referral with one button, and it will populate information on that referral. It'll populate the information on that referral that it's able to pull from the document. It could be an authorization code for a referral that I don't have to manually type. It attaches the document and allows you to move on with your business, right? Or it could be a lab document that we're seeing over here. It's a lab document, right? Hopefully, most of your lab results are coming in through some sort of an interface, right? Quest, lab probe, and whatnot. But oftentimes, you might get something that comes into your fax inbox, and you need to attach this document to that specific order. If it recognizes that this is a lab order or something like that, it'll actually show you your orders, and you can attach the document accordingly. So that's where it can be useful from that perspective, right? So image AI. How do you check in patients right now? There's obviously multiple processes, but typically patient comes in, you gotta be on the appropriate provider schedule, you gotta find the appointment on the schedule, open it up, you know, capture information from the patient and check the patient in. Can we use image AI? We have facial recognition on our phone. So when a patient comes in, take their image, if we have one on file, it will automatically open the appointment for you of that patient. And again, that technology currently exists right now in the healthcare space. It's available, right? So again, we're not replacing staff, but we're removing a lot of processes, a lot of manual processes from that space. So essentially, what you're able to do is go from all of these steps. You got a camera there. You just capture the patient's image, open up the appointment, and take action from there. Okay. Any questions on that component, virtually or otherwise? All right, very good. This is a big one. 2 national networks that have been in business for quite some time. And most of the EMRs, regardless of what EMR you're using, they support one or both of those 2 national networks. They're called Commonwealth and Care Quality. Okay? They're essentially the 2 networks that allow for data exchange between different organizations in a secured capacity. eClinicalWorks is a member of both. And with this progression of interoperability, it's allowed providers over the years to receive external data. Because sometimes when you're trying to put together a plan for your patient or trying to make medical decisions, if you're making decisions based on only data that you have documented in the past, that's only a piece of the pie, right? It's not comprehensive. So you want to be able to look at external data. We know patients see specialists, they have hospital visits. Sometimes they go on vacation and they end up having to go into urgent care or hospital. So there's a lot of data out there, and you want to be able to receive those external records. That platform has been there for quite some time. We're at a point right now where we are exchanging about 3 million records per day, 2.5, 3 million records per day. So as a provider, I'm seeing a patient, and here's another statistic out there. Patients that are 65 years of age or older, their medical record is approximately the size of Hamlet, which is pretty large, right? So as a provider, if I have 15 minutes with my patient and I'd like to review some external data for my patient, do I really have time to go through all those records, right? To try to absorb, make sense of that information and, make the appropriate medical decision? I really don't, right? And this is the data that we're talking about, 2.5 million records shared daily. So can I use AI to try to process that data for me and summarize it and make it palatable for me to digest? That's the big question. And it can. I mean, certainly the technology is there. This is just an example from our perspective of how it looks like, regardless of what system you're using. You probably, if you're receiving external records, you have some version of this basically, where you have a list of all the records for the patient, external to your organization. And when you look at an individual record, sometimes it's a dozen pages. So do I have time to scroll through there, look for the information that I want? This is where AI can be used to summarize a record for you, okay, with essential components over here. So you have the original format, right? And I don't know if you can see it on here. You have the highlighted format. This is for an individual record. What if a patient has 30 individual records on there? Even if I highlight this, that's still going to be a little bit overwhelming. So then you have the search component over here, where you have the ability to search records for a specific element that you're looking for. So search is pretty easy. It's like a control find on your document, right? You're looking for a keyword. But sometimes I don't know what that keyword is that I'm looking for. So can I put a contextual search in there and tell the AI, is there any history of like shoulder pain for this patient? Okay? And the record is not, that the system is not looking for a specific keyword, but it's able to scan those documents and say, you know what, there's indications of shoulder pain in this particular external document. Let me take you to that document. So your search can be contextual in nature, and it will try to give you the information that you're looking for. So that's a search component. However, most providers, what they want is all of these records that we're talking about, those, dozens of records for a particular patient. Can you summarize all of those records for me into one blurb over here? Okay, that's where you have the full records highlighted, right? With essential information, the external timeline of the patient, right? That are relevant, external results, vitals, all of that information summarized into one page. Now, as a provider, I have access to more comprehensive information for a patient, but it's not going to take me 30 minutes just to review that information. I can do it in a few minutes and make the appropriate medical decisions over here. Okay? So this is where AI can be used to process all of this external technology, external records over here. And then one of the last components that I want to discuss is no-shows. And in your organization, on average, providers have about 2 no-shows per day, about 10 no-shows per week. And there was an NIH study, National Institute of Health, that was studied, a study that was completed more than 5 years ago. They were essentially working on this price transparency study to determine what is the cost of a typical visit. And they determined that the cost of a typical office visit is something about $140 or $150, for an office visit. So just take that into mind. If you have 2 no-shows on a daily basis, time spent, multiply that by the number, of days that you see patients in a year, that's potential loss of about $50,000, right? Per provider. If you have numerous providers in your organization, multiply that. So this happens even with organizations using technology to send appointment reminders, right, and emails to the patients. So if I had a probability, if I had some technology that told me, this is the probability that this patient is going to no-show for your appointment, can I have more focused outreach to those patients, right? If the system is telling me there's a 98% chance that this patient is going to no-show for the appointment, what do? Maybe in addition to the appointment reminders, this is where I can have my staff maybe pick up the phone and say, let's call this patient and see if we need to reschedule. Because I don't want an empty slot in my appointment, right? Or in some cases, do I double book that slot maybe for a second appointment there? I know CMS doesn't like that, but from a visibility perspective, right? All of your appointments, if you have such technology, would actually have a percentage in that appointment slot that tells you this is the probability of no-show for that particular appointment. Now, some organizations will say, this is not a problem. We double book all of our slots, right? How stressful is that for your providers if you're double booking all of your slots? What if you're a little bit more strategic? And the reason you double book is because you know you have cancellations and no-shows and all of that. But what if I have data that allows me to be more strategic, right? And maybe take the edge off stress for providers in terms of how many patients they're seeing, because you know you're going to fill all those slots over here. And then you can have, you know, an administrative dashboard with all of the patients for a particular day. You can filter by no-show probability, and you can assign it to your staff to, you know, outreach to patients, you know, and that no-show. So that's machine learning, essentially, is what it is. It is an algorithm that is looking at probably dozens and dozens of variables into the system. But one important thing is none of those variables should introduce bias into this. So none of these variables should be what is the zip code of the patient, or what is their ethnicity, or language, and all of these things. We don't want to introduce bias. We want to strictly look at data from time of day, time of week, time of year. Has this patient made their copay? If they haven't made their copay, all of these things determine what is the possibility of no-show, basically. So this is something that is also being deployed. This is an organization. New York, they have, I think, about 250 providers, right? And they deployed this, and they were able to increase their high no-show probability show rate, something about 154%, which is a big deal, right? I just looking at data and making small changes, having staff doing additional outreach to the patients. So this technology can help your front office staff and help your bottom line at the end of it. So, and there's many more applications, right, in terms of AI that we could look at. It's applications unlimited. I think we will continue to see more and more applications in the AI space. Things from a scheduling perspective, right? So currently, if I want to schedule an appointment, I probably have to go physically look on my schedule and say, okay, there's an empty slot here. Can I tell the AI, I want to book an appointment for this patient with this provider at the next available slot? You put it contextually and you let the system do it. That technology currently exists right now. How about documentation? How many patients have you tried to share a visit summary with that say, can you share it with me in Spanish or in Portuguese or in Russian, right? Can we use AI to just translate that real time and send it? Yes, the technology is there. Administrative tasks. For users of eClinicalWorks, if you guys are familiar with security settings in the system, right? We have about 1,000 security settings in the system. More, right? So sometimes I'm trying to give somebody or take away security settings from them. Do I have time to go through 1,000 security settings or my setting in the system? I can just tell the AI, I need to give the rights to a particular provider to be able to customize the progress notes, or I need to take away the right from an individual to be able to delete a lot in the system. Where is this setting in the system? And the AI has access, you know, to the tables on the back end, and you say, this is where it is. Let me take you to that screen. Let me highlight it for you so you can apply the setting accordingly, right? So the search component, registry, sometimes I'm looking for a set of patients that meet a particular, you know, parameters or criteria and whatnot. Can I tell the system, show me a list of all my diabetic patients who have not had an A1C visit or an A1C result, you know, in the past 6 months, you know, and then let the system do the work, right? Or how-to questions. If you're an organization, you have a new user to your system that is learning how to perform functionality. Can they ask the AI, how do I build a template? Or how do I customize a template in the system? So the applications are endless. These are all additional applications that currently exist for companies like us. And regardless of the EMR system that you're using, there's probably some sort of component of that as well. So with that, I know we're coming up on time. We will open it up to questions over here, virtually or from the audience, or discussions. It doesn't have to be a question, or feedback. So here you go.
Any feedback or questions? Bringing you the mic.
So I mentioned I'm investing in training my staff in AI and how it can help. And we're actually using a service called AI for printers. So anyhow, when I talk to people in the community about this, they hear the mainstream stuff about AI, and they're concerned. My dad, for instance, he said, yeah, the only problem with AI is as it grows, it's going to start feeding on itself.
Yeah.
You mentioned private servers. Sounds like that's the answer to that issue. Is
Yeah. The AI could be good or bad. It's like having a new baby, and how are you going to raise that baby, essentially? The data that you feed it will determine essentially the output that you get, right? But if you use public domain, so we talked about public domain, right? Then we can't speak to the quality of the data, right? So you have to put, a framework in place. You have to put parameters on it and say, okay, make decisions based on this data set, right? That's where you limit it. Yeah, and the private instances that we talk about cloud, that's from a security perspective, right? You don't want your data out there in the ether, right? You want to make sure you have access to the data, because the majority of healthcare organizations, you guys don't manage your own data centers, right? You don't have your own. Some of you might, but for the most part, you let the technology company handle that. So you need to be confident that your technology company has that secure infrastructure in place as well.
Any other questions on AI or parenting? Jesse, anything in the Zoom room? All right. Well, will you guys please help me thank Hussein for being with
And you are welcome to reach out to me for further discussions or anything. This is my information over here. Sometimes you're a little shy to ask a question in the audience. But thank you again so much.
Yeah, thank you.
Yeah.
All right. So everyone, I am going to ask, and this is an ask of both folks in the room and our virtual audience, if you will help us plan these future sessions. So there are instructions on your table for our Zoom folks. There's instructions on your screen about how to get into our poll. We're just going to take a quick poll, get a little bit of feedback from you guys. I've mentioned the Healthcare Association has an advisory council that meets regularly, and they need to determine the programming elements and really what we're going to be covering over our roundtables. And so it's really helpful for them, and certainly for me, because I am about as healthcare as these AI tools are, Hussein. So it's helpful for us to hear from you guys about what your needs are. So Jesse's going to be switching over to our poll, but if you would kind of log into our polling system, we're going to get a few answers from you guys and actually have these live on the screen. So just really quickly, as we know, we're always talking workforce. Let us know, what level would you say your practice's staffing is at right now? A is 100%, B is 75%, C is 50%, D 25%, and E, your practice isn't even open today because you're hanging out with us. All right. Well, I will say, if my memory serves me correctly, we asked you all this question a year ago. I think things are getting a little better, folks. All right. We'll move on to our next question. On a scale of 1 to 5, with 5 being constant and 1 being never, rate your practice's amount of staff turnover. So looking at 1, you never have any turnover. 5, it's happening all the time. Tell us where you feel like you guys land. All right. Thank you for that feedback. Jesse, we'll go on to the next question. Asking, what's the top challenge your practice will have 12 months from now? Just your gut feeling. What's the top challenge your practice will have 12 months from now? And you can just type those answers in. And for our virtual audience, we're getting your answers too. So far, we're getting, okay, here comes a little variety, but a lot of staffing. A lack of training relating to staffing. Well, budgets, okay. Maybe next time we'll have a poll on staffing and just let everybody kind of put their tally mark beside it. And then what topics do you want to have covered here in roundtables? So same thing, just type in your responses. What would you like to hear? What types of speakers would you like to hear from? What type of topics? Even if it's something that we have covered in the past, if you're like, hey, we need more of that, or it's been a while since we talked about this, please give me those ideas. Conflict resolution, hopefully folks were able to be here for that session, but it was a great one that I think we want to keep in rotation. Staff retention, certainly, always good ideas coming out of those sessions.
One of the highest attendance too was office safety. So if you missed that one or if you enjoyed it, we'll probably consider doing that one again.
Yeah, Kathy's mentioning office safety. Coaching, it's a great one. Team building, I see that on there. Team building, coaching, mentorship. Awesome. Some ideas we haven't tackled, or at least not in a while, so.
How about recruiting or interviewing new employees, things like that, because I think sometimes people present well maybe on a resume, but, you know, I think there is a science to interviewing and hiring.
All the steps to the hiring process. Recruiting, got it up there. Ethics, certainly in the healthcare space. Awesome. All right. Well, thank you all so much for that feedback. I appreciate it. It's something that I'm able to share with the advisory council. And we do have our next roundtable in the fall coming up on November 14th. So please go ahead and mark your calendars for that one. With that, I'm going to ask Jesse to close our Zoom room. But for folks in the room, we do have some raffle prizes. And for our virtual attendees, help us with our no-show rate and come for the chance to win a raffle prize.
Because I know Eric came up here from printing up here, but he didn't really talk about himself. It's always easier for others to brag on other people. But I just want to make sure you guys know his business is here and coming, easy to work with, easy to access. I don't want to say we want urgent projects, but he always comes through for me. Chamber uses a lot. He does lots with the schools, but he does a ton of healthcare stuff with myself. And then I heard a lot of the offices as well. So we could sell business cards and flyers and different things like that. Of course, I just want you guys to know that he's a trusted source here, right in our county.
He's so trusted that I'm going to ask him to come draw our winners.
Draw winners, not.
That's right, that's right. Brought no revenue.
So looking for ticket number. So we've got a couple of prize options up here. We're going to go first with our Wonder Boom mobile speaker system. Looking for ticket holder